10 strange signs. Your kidneys are crying for help. I'm about to reveal something shocking that could save your life or the life of someone you love. This isn't about some expensive detox or a fancy supplement. It's about understanding the strange yet crucial signs. Your kidneys might be in trouble, signals that often go unnoticed until it's too late. Your kidneys play a vital role in your health, and ignoring these warning signs could lead to serious complications. But the good news? Catching these signals early could mean preventing irreversible damage and restoring your body's balance. Stick around, because what you're about to learn could be the wake-up call you didn't know you needed. The kidneys are truly unsung heroes of the body, quietly working away without much attention until something goes wrong. Nestled on either side of your lower back, these bean-shaped organs are much more than just filters. Think of them as the body's master multitaskers. They don't just remove waste products and excess fluids. They also play a crucial role in maintaining a delicate balance of minerals like calcium, sodium, and phosphorus in your system. These minerals are vital for everything from bone health to nerve function. And that's not all. Your kidneys are also a key player in regulating blood pressure. By controlling the amount of fluid in your bloodstream and releasing hormones, they help keep your blood pressure within a healthy range. Surprising, right? But there's more. Your kidneys are indirectly responsible for your energy levels. How? By helping your body produce red blood cells. They release a hormone called erythropoietin, which signals your bone marrow to make red blood cells, ensuring that your hemoglobin levels stay in check. Without properly functioning kidneys, you might start feeling unusually tired or even anemic. Here's another fascinating fact. Vitamin D, which we often associate with sunlight and strong bones, is practically useless in its raw form. It's your kidneys that activate this vitamin, converting it into a form your body can use. This process is critical for calcium absorption, which keeps your bones strong and healthy. So, when your kidneys aren't functioning properly, all these vital processes can go haywire. Now, here's the scary part. Kidney dysfunction doesn't announce itself loudly in the early stages. It's often called a silent killer because symptoms rarely show up until significant damage has already occurred. By the time most people realize there's a problem, a staggering 80% of kidney function may already be compromised. This is why it's so important to stay vigilant and aware of subtle changes in your body. But don't let that worry you too much. The good news is that your body does drop hints if you know what to look for. By being proactive and paying attention to unusual signs, you can catch kidney issues early and take action before they escalate. The key is to listen to your body and not ignore what may seem like minor or unrelated symptoms. After all, your kidneys are essential to your overall well-being, and a little care can go a long way in keeping them healthy. So, let's deeper into those strange but telling signs that your kidneys might be crying out for help. Foamy or bubbly urine. Have you ever noticed your urine looking extra foamy or bubbly when you flush the toilet? Maybe it caught your eye for a moment and you shrugged it off. After all, isn't it normal for urine to look different depending on what you eat or drink? The truth is, while the occasional frothy urine might be harmless, perhaps you were dehydrated or urinated with more force than usual, persistent foamy urine is a sign you should never ignore. It might be your kidneys waving a red flag, urging you to pay attention. You see, your kidneys have a big job. They act as the body's filtration system, sifting out waste products and extra fluids from your blood, while keeping essential substances like protein and nutrients where they belong, in your body. One of these vital proteins, called albumin, is crucial for maintaining fluid balance in your bloodstream. But when the tiny filters in your kidneys, known as glomeruli, get damaged, they can start leaking albumin into your urine. This leakage is what creates that frothy or bubbly appearance. Imagine pouring milk into a glass but finding it unusually frothy, almost like a cappuccino foam layer. That's not normal, right? The same principle applies here. Your urine is trying to tell you something about what's happening inside your body, specifically with your kidneys. This condition, known as proteinuria, is often an early warning sign of kidney damage. But why does this happen? There are several reasons. Chronic conditions like diabetes and high blood pressure are leading culprits. These illnesses can damage the delicate filtering system of your kidneys over time, making it easier for protein to escape. Other causes could include kidney infections, autoimmune diseases like lupus, or even excessive use of over-the-counter pain medications that stress your kidneys. Here's the tricky part. Foamy urine doesn't always come with other symptoms. You might feel completely fine, which is why it's so easy to overlook. But ignoring it could allow kidney damage to progress silently. By the time other symptoms like fatigue, swelling, or changes in urination patterns appear, significant damage may already have occurred. The good news is that proteinuria is often reversible if caught early. Doctors can perform a simple urine test to measure the protein levels in your urine. If elevated protein is detected, further tests like blood work or imaging may be done to assess your kidney function and pinpoint the cause. From there, lifestyle changes like reducing salt intake, managing blood sugar levels, and staying hydrated can help ease the burden on your kidneys. So, the next time you see frothy urine, don't just brush it off. Think of it as an important message from your kidneys, one that could help you catch a potential problem before it spirals out of control. After all, taking care of your kidneys means safeguarding your overall health. Listening to these subtle signs could make all the difference in preventing long-term complications. Persistent fatigue. Everyone gets tired now and then, right? Maybe you stayed up too late or worked a bit too hard, and now you're feeling drained. But what if this tiredness doesn't go away? Imagine waking up after a full night's sleep, only to feel just as exhausted as when you went to bed. You try to push through your day, but the fatigue clings to you like a heavy fog. This isn't ordinary tiredness. It could be your kidneys sending you a distress signal. Your kidneys play an essential role in keeping your energy levels stable. They produce a hormone called erythropoietin, EPO, which signals your body to create red blood cells. These red blood cells are like oxygen delivery trucks, transporting fresh oxygen to every part of your body, from your muscles to your brain. When your kidneys aren't functioning well, they produce less EPO, which means fewer red blood cells are made. This condition, called anemia, leaves your body struggling to get enough oxygen to fuel your daily activities. The result? Persistent fatigue. You might feel like you've been running a marathon, even if all you did was climb a flight of stairs. Your muscles feel weak, and your brain feels foggy, making it hard to focus or stay motivated. This isn't just physical exhaustion, it's mental and emotional too. Over time, it can impact your mood, leaving you irritable, depressed, or even anxious. But what causes your kidneys to slow down in the first place? Chronic conditions like diabetes and high blood pressure are often to blame. These conditions can damage the delicate blood vessels in your kidneys, reducing their ability to filter waste and produce EPO. Other causes include kidney infections, autoimmune diseases, or even dehydration, which can strain your kidneys and make them work harder than they should. What's frustrating is that this kind of fatigue often creeps up on you. It doesn't announce itself loudly, it builds gradually, making it easy to dismiss as normal tiredness. But if this exhaustion persists, especially when paired with other symptoms like pale skin, shortness of breath, or swelling, it's time to take action. The first step is to talk to a doctor. They can perform simple blood tests to check your hemoglobin levels and assess whether your kidneys might be the culprit. If anemia caused by kidney dysfunction is detected, treatments like iron supplements, EPO injections, or lifestyle changes can help. Managing your overall health, especially conditions like high blood pressure or diabetes, is crucial in preventing further kidney damage. Swollen feet, ankles, or hands. Picture this. You slip on your favorite shoes in the morning, and by the afternoon, they feel uncomfortably tight. Or maybe you go to remove your rings and they're suddenly hard to take off. Swelling in your feet, ankles, or hands, known as edema, is one of the most common yet overlooked signs that your kidneys might be in trouble. Your kidneys are responsible for maintaining the balance of fluids and electrolytes in your body. Think of them as your body's drainage system. They filter out excess water, salts, and waste, ensuring that only the necessary amounts remain. But when your kidneys aren't functioning properly, this drainage system starts to falter. Instead of flushing out extra fluid, your body holds onto it, causing swelling in areas like your feet, ankles, and hands. Now, you might wonder, why the extremities? The answer lies in gravity. When excess fluid accumulates, it naturally pools in the lowest parts of your body, especially if you've been standing or sitting for long periods. The swelling might start small, perhaps just a feeling of puffiness, but over time, it can become more noticeable and even painful. But swelling isn't just about discomfort. It's your body's way of hinting at an underlying issue. When the kidneys fail to remove extra salt, it stays in your bloodstream, pulling water into your tissues. This can also lead to increased blood pressure, creating a vicious cycle where high blood pressure further damages your kidneys, and impaired kidneys make it harder to control blood pressure. Other conditions might mimic these symptoms. For instance, heart failure or liver disease can also cause fluid retention. But the difference is that kidney-related swelling is often accompanied by other signs like changes in urination, fatigue, or foamy urine. Ignoring this symptom can lead to more serious complications. Swelling that persists unchecked can strain your heart and lungs, making it difficult to breathe and increasing your risk of heart failure. That's why it's crucial to address it early. So, what should you do if you notice persistent swelling? First, don't panic. Pay attention to patterns. Is the swelling worse at certain times of the day? Does it go away after resting or elevating your legs? If it doesn't improve or continues to worsen, it's time to consult a doctor. Simple tests, like a urine analysis or blood work, can reveal whether your kidneys are functioning properly. In the meantime, there are steps you can take to reduce swelling. Cutting back on salt is a big one. Sodium makes your body retain water, so keeping your salt intake low can ease the strain on your kidneys. Staying hydrated is equally important. Yes, even when you're swollen. Proper hydration helps your kidneys flush out toxins more efficiently. Swelling might seem like a minor inconvenience, but it's often a sign of something bigger. By listening to your body and taking proactive steps, you can address the issue before it spirals into something more serious. After all, your health is worth the effort. Changes in urination patterns. Have you noticed that your bathroom trips have become more frequent, less frequent, or just plain unusual? Changes in urination patterns are one of the clearest signals that your kidneys might be struggling to do their job. After all, the kidneys are the gatekeepers of your urinary system, filtering waste and excess fluids from your blood and sending them out of your body as urine. When they're not functioning well, these changes can show up in surprising and sometimes alarming ways. One of the first things you might notice is an increase in how often you're urinating. It's late at night, and instead of sleeping soundly, you find yourself running to the bathroom repeatedly. This condition, known as nocturia, can be a subtle sign of kidney trouble. Healthy kidneys concentrate urine and control the amount you produce at night, but when they're damaged, they can't regulate this process as effectively. On the flip side, some people experience a decrease in urination. If your kidneys are filtering less fluid, you may find that you're producing less urine, even if you're drinking your usual amount of water. This could also lead to discomfort or the sensation of needing to go without actually passing much urine, a symptom commonly linked to kidney infections or blockages in the urinary tract. But it's not just the frequency that changes, it's the appearance too. Dark amber-colored urine can indicate dehydration, but if it persists despite drinking enough water, it might point to underlying kidney issues. Blood in the urine is another red flag. Known as hematuria, this symptom can occur when the kidney filters are damaged, allowing blood cells to leak into your urine. It's a serious sign that shouldn't be ignored, as it might also point to other conditions like kidney stones, infections, or even tumors. Foamy or bubbly urine, as mentioned earlier, can signal the presence of protein, a sign that your kidneys aren't keeping essential nutrients where they belong. And then there's cloudy or strong-smelling urine, which might indicate a urinary tract infection, UTI, something that can escalate to kidney damage if left untreated. So why do these changes occur? Chronic conditions like diabetes and high blood pressure are often the root cause. Over time, they damage the tiny blood vessels in your kidneys, impairing their ability to filter waste properly. Autoimmune diseases, certain medications, or even prolonged dehydration can also contribute. If you notice unusual changes in your urination, it's important to act quickly. Start by observing your symptoms closely. Is the change temporary, or does it persist for days or weeks? Are there other symptoms like pain, swelling, or fatigue? Keeping track of these details can help your doctor pinpoint the cause more effectively. The solution often depends on the underlying issue. A simple urine or blood test can reveal a lot about your kidney health, and your doctor might recommend dietary changes, medications, or further tests to address the problem. Shortness of breath. You're going about your day when suddenly even the simplest activities like climbing a flight of stairs or walking to the car leave you gasping for air. You chalk it up to being out of shape or perhaps too stressed. But what if it's your kidneys trying to send you a message? Shortness of breath, while often associated with heart or lung issues, can also be a sign that your kidneys are in trouble. When your kidneys aren't working properly, they can't efficiently remove waste and excess fluid from the body. This fluid buildup doesn't just stay in your feet or ankles, it can accumulate in your lungs as well. When fluid builds up in the lungs, it's known as pulmonary edema, which makes it harder for your lungs to exchange oxygen properly, leading to the feeling of breathlessness. This can happen gradually, with mild discomfort at first, or it can come on suddenly and be more severe. But kidney-related shortness of breath can also happen without the presence of fluid in the lungs. When your kidneys are damaged, they might not be able to regulate your body's levels of important electrolytes, such as potassium. An imbalance of potassium can directly affect your heart, causing it to beat irregularly, which in turn leads to feelings of breathlessness and fatigue. If you've noticed that you're frequently short of breath or feeling winded even after light activity, it's time to pay attention to your body. While other conditions like asthma or allergies might cause similar symptoms, shortness of breath combined with other signs of kidney trouble, such as swelling, changes in urination, or fatigue, warrants a visit to your healthcare provider. Addressing this symptom early is crucial. If fluid retention in the lungs is the cause, your doctor may prescribe diuretics to help your kidneys remove excess fluid. Medications to correct electrolyte imbalances or manage underlying conditions like high blood pressure or diabetes might also be recommended to protect your kidneys and heart. So, while shortness of breath might seem like just another annoying side effect of a busy life, it's important to consider all possible causes. By listening to your body and acting promptly, you can take steps to ensure that your kidneys and your overall health stay in check. Persistent puffiness around the eyes. We all wake up looking a little puffy sometimes, whether it's from a restless night, too much salty food, or even allergies. But what if the puffiness around your eyes doesn't go away? It's persistent, showing up every morning and lingering for hours. When this happens, it might be a clue that your kidneys aren't functioning as they should. The skin around your eyes is delicate, and it's often one of the first places where swelling shows up when there's fluid retention in your body. As we've discussed, the kidneys are responsible for regulating the balance of fluids in the body. But when they start to fail, your body can't effectively flush out excess fluid, which can lead to it accumulating under the skin, especially around the eyes. This puffiness, often more noticeable in the morning after you've been lying down all night, is a common symptom of kidney disease. It occurs when protein is lost in the urine, proteinuria, causing the body to retain more fluid. The loss of protein, particularly albumin, lowers the pressure inside your blood vessels, making it easier for fluid to leak into surrounding tissues, resulting in swelling. The puffiness might not always be painful or uncomfortable, but it can be frustrating and worrisome. If you're noticing persistent eye puffiness along with other symptoms, like foamy urine, fatigue, or swelling in other parts of your body, it's time to consult with a healthcare professional. Don't wait for the swelling to worsen. With early detection and treatment, you can prevent kidney damage from progressing. Your doctor might recommend a urine test to check for protein and other abnormalities, as well as blood tests to assess your kidney function. A healthy diet, low in sodium, and plenty of water can also help alleviate some of the fluid retention caused by kidney dysfunction. In some cases, medications like diuretics may be prescribed to help your kidneys remove excess fluid and reduce the swelling around your eyes. While puffy eyes can happen for many reasons, persistent puffiness that doesn't go away and is accompanied by other kidney-related symptoms is a signal that should be taken seriously. Metallic taste in mouth or ammonia breath. Have you noticed a strange metallic taste lingering in your mouth, even after brushing your teeth? Or maybe you've picked up on an ammonia-like smell on your breath, something that's hard to ignore and even harder to explain. Believe it or not, these symptoms could be linked to kidney problems. When the kidneys are functioning properly, they filter waste products and excess substances out of the body through urine. But when they start to fail, toxins like urea and creatinine begin to build up in the blood. This accumulation of waste products can affect your sense of taste, giving you that unpleasant metallic flavor in your mouth. The ammonia-like breath, also known as uremic breath, happens because of the buildup of urea in the blood. Urea is a byproduct of protein metabolism, and when the kidneys aren't able to clear it out, it starts to accumulate in the body and eventually makes its way out through your breath. This can create a strong, distinct odor that's similar to ammonia, Both of these symptoms, the metallic taste and ammonia breath, are often early indicators that your kidneys are in trouble. And while these issues are more commonly associated with advanced kidney disease, they can start to develop long before any significant symptoms appear. If you notice this strange taste or odor, it's essential to consult your healthcare provider. These symptoms are a sign that your kidneys are struggling to clear out waste products, which means they need attention. A blood test to check for levels of urea and creatinine will help determine how well your kidneys are functioning and whether further tests or treatments are necessary. In the meantime, staying hydrated can help flush out some of the toxins building up in your system, and adjusting your diet to reduce protein intake might help alleviate some of the symptoms. But the key is early intervention. By catching kidney problems early, you can take proactive steps to protect your kidneys and overall health. Nausea and vomiting. It's not uncommon to feel nauseous or even throw up after a particularly heavy meal, or if you've got a stomach bug. But when nausea and vomiting become persistent, they might be more than just an upset stomach. They could be signs of kidney dysfunction. As your kidneys begin to fail, waste products that are normally filtered out through urine start to build up in your blood. These toxins can cause a variety of symptoms, including nausea and vomiting. Your body is essentially telling you that it can't keep up with the removal of waste and that it's starting to have a toxic effect on your system. Nausea and vomiting in kidney disease can happen for several reasons. First, the accumulation of waste products like urea can irritate the digestive system, leading to nausea. Second, the imbalance of electrolytes, such as sodium and potassium, can disrupt normal bodily functions, causing feelings of sickness. Lastly, the buildup of fluid in the body can make you feel bloated and uncomfortable, further contributing to nausea. This symptom is particularly concerning because it's not just about feeling unwell, it can lead to dehydration, which worsens kidney function. As you lose fluids through vomiting, you make it harder for your kidneys to filter out toxins, creating a vicious cycle. If you experience persistent nausea or vomiting alongside other kidney-related symptoms, such as changes in urination, swelling, or fatigue, it's time to seek medical attention. Early intervention can help manage symptoms and prevent further kidney damage. Your doctor may recommend blood tests to assess the level of waste products in your blood and adjust your treatment accordingly. In some cases, dialysis may be needed to help remove excess toxins and relieve symptoms like nausea. Muscle cramps. You've been going about your day, and suddenly your calf muscles seize up in a painful cramp. It's sharp, it's intense, and you can't seem to stretch it out. While muscle cramps can happen for a variety of reasons, dehydration, overexertion, or a lack of certain minerals, they can also be a sign that your kidneys are struggling. Your kidneys are responsible for balancing the levels of electrolytes like potassium, calcium, and magnesium in your body. These minerals play a vital role in muscle function. But when the kidneys aren't functioning properly, the balance of these electrolytes can be disrupted, leading to muscle cramps, spasms, and weakness. Kidney disease can cause both high and low levels of potassium. Low potassium, known as hypokalemia, can trigger muscle cramps, weakness, and fatigue. On the other hand, high potassium, hyperkalemia, can have serious effects on your heart and muscles as well. If you're experiencing muscle cramps along with other kidney-related symptoms, such as changes in urination, swelling, or fatigue, it's important to take them seriously. Persistent cramps or spasms that don't seem to improve with hydration or rest could be a sign of kidney dysfunction. Your doctor can test your blood to check electrolyte levels and determine if kidney issues are the cause of your cramps. Treatment may involve dietary changes, medications, or even dialysis if kidney function is severely impaired. Your kidneys are small, but their job is huge. From filtering waste to regulating fluids and supporting vital functions like blood pressure and red blood cell production, they're always hard at work behind the scenes. If you're noticing any of these signs, don't wait for things to get worse. Early detection is key to protecting your kidney health and preventing long-term damage. So, take control of your health today. If you've experienced any of these symptoms, it's time to talk to a healthcare professional. The sooner you address potential kidney issues, the better your chances of keeping everything running smoothly. If you found this information helpful, don't forget to like, share, and subscribe. And drop a comment below. Have you experienced any of these signs, or do you have any questions about kidney health? Let's keep the conversation going.